everyone, I myself, Dr. Moana, and I welcome you back to Med Talk with Moana at Wellness Way. So, ఇదివరకు ఎపిసోడ్స్లో చాలా మంది డాక్టర్స్ని కలిసాం, చాలా టాపిక్స్ డిస్కస్ చేసాం, హార్మోనల్వి, థైరాయిడ్ అని, డయాబెటీస్ అని, అవి ఇవి. So, today we have Dr. Ashish Chauhan, consultant physician and diabetologist at Apollo Hospital, Secunderabad.
Hello, I am Dr. Ashish Chauhan, consultant physician, Apollo Hospitals, Secunderabad. A graduate from CMC Vellore and a postgraduate from CMC Ludhiana, a Punjabi by birth. But I am staying and working in the city of Nizams from last 2 decades, only and only with one mission and vision. Can I make sure that none of you, yes, none of you ever get admitted in any hospitals? And if you want to know the tips, and if you have a diabetes, hypertension or obesity, continue watching this Med Talk of mine with Mona. Yes, so here today we are here to talk about many different aspects of diabetes which nobody has ever touched, I must tell you. So do listen to this discussion of ours and do get to know diabetes in a different format and the different angle of it. Remember the acronym DIET, and how important is that? That's what we're going to discuss it out soon. Till the time, we'll get back to you again. Take care.
Hi, Doctor.
Hello, Mona.
How are you?
I'm doing great.
First of all, thank you so much for sparing your time for my show.
Absolutely no possibility to say no at any cost. When I got an invitation from you, I thought I had to do it.
సో ఈ రోజుల్లో చాలా మందికి రకరకాల ఇష్యూస్ ఏంటంటే చిన్న ఏజ్లోనే పిల్లల దగ్గర నుంచి టీనేజర్స్ దగ్గర నుంచి మిడిల్ ఏజ్ అసలు ఎలాంటి ఏజ్ డిఫరెన్స్ లేకుండా అందరిలో ఎక్కువగా కనిపిస్తున్న ప్రాబ్లం డయాబెటీస్. సో ఆన్ బీయింగ్ ఎ జనరల్ ఫిజిషియన్ అండ్ డయాబెటాలజిస్ట్, వాట్ ఆర్ యువర్ వ్యూస్ ఆన్ ఇట్?
Diabetes గురించి మాట్లాడాలి, then I think it will take pretty full day to discuss about it. Few facts మీ ఆడియన్స్ కొరకు. Every 6 seconds we lose somebody with diabetes. Every minute we lose 10 people with diabetes.
Every minute?
Every minute 10 people with diabetes. Ippudu it has become a tsunami of diabetes among us. So monone konni rows back I had gone to United States and I was welcomed in a diabetic conference as Dr. Garu, we are very happy to have somebody representing diabetic capital of the world. I was wondering, is he welcoming me or is he insulting me? Okay, but our time ki I realized, yes, we are the diabetic capital of world. India is the diabetic capital of world, but by the way, meeku any guesses which is the diabetic capital of India?
No idea.
Hyderabad.
Really?
Andhra Telangana is the diabetic capital of India. So we have very many patients with diabetes and it's spreading very fast. Irrespective of age, caste, creed, religion, sex, gender, anything, andarki this is kind of engulfing it. And కొన్ని patients ki, or at least good number of patients ki, we find it ఒక రోజు హార్ట్ అటాక్ వచ్చింది, పెరాలిసిస్ వచ్చింది, ఆ రోజుకి we get to see that he's got a sugar of 400, 500.
Oh my.
So ఈ రోజు I have a young girl admitted with me, 23 years old. I had told me, sir, I want to go to UK back for some work. She's a student from UK. And her sugars are 500, 700. Thyroid is
700?
700, yeah, absolutely. And she's got other issues and she did not want to get admitted also. So diabetes has become a very common disease. Konni patients ki you will have some symptoms, konni patients ki you will have no symptoms at all. So it kind of affects your body head to toe. So that's why after doing my graduation from CMC Vellore, then I did a post-graduation in CMC Ludhiana. And from 15-20 years, I've been practicing in the city of Nizams. And I found the one place where I need to educate everybody and work maximum is diabetology. So that's what I'm with Apollo talking and telling everybody about the preventive diabetology. Oka mata cheppali, I am an outsider, I am a North Indian. But I have realized talking to Telugu people about prevention is chala kashtam. They will not listen. Like only heart attack, paralysis vachaka, they will address an issue. Otherwise, they don't listen to a doctor. So that's a big kind of issue in me handling my patients.
See, doc, అంతవరకు ఎందుకు ఇంట్లో ఫ్యామిలీ మెంబర్ లెట్స్ సే హస్బెండ్ డయాబెటిక్ అనుకోండి, ఆ వైఫ్ ఇది తినకండి అది తినకండి మళ్ళీ షుగర్స్ ఎక్కువ అవుతాయి, ఈ స్వీట్స్ వద్దు అది వద్దని ఏదైనా చెప్పినా కూడా ఆ చిన్న విషయం మీద అది చాలా అగ్రెసివ్గా గొడవ అయిపోతుంది. యాజ్ దట్ లైక్ వీ హ్యావ్ నో క్లూ ఆ గొడవ ఎక్కడి వరకు వెళ్తుందో. సో అది మరి మెంటల్ ఇంబ్యాలెన్సా లేకపోతే ఆ డయాబెటీస్ వల్ల వచ్చే డిప్రెషనా? What exactly it is? Why people start acting so weird when they get to know that they are diagnosed with diabetes?
అది గురించి మాట్లాడాలి. ఐ వుడ్ వాంట్ టు టెల్ యూ, మాకు వి ఆల్ నీడ్ షుగర్ ఇన్ అవర్ బాడీ ఇన్ నార్మల్ క్వాంటిటీ. ఎక్కువ అయితే కష్టం, తక్కువ అయితే కష్టం. సో ఇఫ్ యూ హ్యావ్ అ డయాబెటీస్, ఇట్స్ అ డిసార్డర్. మీ బాడీలో ఇన్సులిన్ సరిగా పనిచేయట్లేదు. అందరు మీ బాడీలో యూ ఆర్ నాట్ అ డయాబెటిక్, ఐఎమ్ నాట్ అ డయాబెటిక్. సో వీ హ్యావ్ ఇన్సులిన్. 1 kg స్వీట్ తినండి, ఇన్సులిన్ రిలీజ్ విల్ ఇంక్రీజ్. మీరు 5 days ఏం తినకండి, యువర్ ఇన్సులిన్ రిలీజ్ విల్ గో డౌన్. ఆ డయాబెటిక్ బాడీస్లో అది ఉండదు. సో దట్స్ వై ఇప్పుడు వీ హ్యావ్ లాట్ ఆఫ్ ఫాస్టింగ్ గోయింగ్ ఆన్, లెంట్ సీజన్ కానీ యూనో రోజా ఫాస్టింగ్, రంజాన్ ఫాస్టింగ్. డయాబెటిక్స్కి ఒక మాట చెప్పాలి, నో ఫాస్టింగ్, నో ఫీస్టింగ్. సో మామూలుగా వీ ఈట్ 3 times per day కదా. You and me have to understand that diabetic patients have to eat small frequent meal. ఒకసారి 2 or 3 idlis బాగలేదు, ఒక గంటలో you can space out and can have 4 idlis also, which is acceptable. So it's a disorder which a person, individual has to understand it. And that is what is missing out in the patient which I see. So that's why I'm very happy with somebody who is as dynamic as you doing a podcast, which will communicate a right message to my audience is what is the need.
A happy family. And suddenly okroju, unfortunately, let's say the husband, head of the family, or a father in the family has been diagnosed with diabetes. And then akkad nunchi a happy family kasta cranky family అయిపోయింది. Why? Because the wife is good at cooking, or let's say anyone else in the family is cooking. I don't say that only wives cook. Okay, so అంత బాగానే ఉంది అప్పటి వరకు. టేస్టీ ఫుడ్, స్వీట్స్, నో డైట్ కంట్రోల్, నథింగ్, అన్నీ బాగానే ఉన్నాయి. సడన్గా హ్యాపీ ఫ్యామిలీ కాస్త ఈ డయాబెటీస్ వల్ల క్రాంకీ ఫ్యామిలీ అయింది. వై?
From happy family to cranky family. I just love the transformation of the words which you have used, Mona. And it's all about attitude. Somebody has to get some disease as per the blessed plans of God. If you are supposed to get diabetes, I don't want you to accept it with sadness and cranky, changes in your lifestyle. You must understand it's a mamulga disorder. Our disorder lo, you need to understand what is the problem with your body. Me body lo, everybody has got insulin. మీరు 1 kg షుగర్ తినండి or స్వీట్స్ తినండి, పుల్లారెడ్డి బాగా ఇష్టం అందరు కదా. అండ్ దెన్ with that 1 kg of sweet, మీ బాడీలో మంచిగా ఇన్సులిన్ ప్రొడ్యూస్ అవుతుంది and your sugar becomes normal. మీరు 4-5 days ఫాస్టింగ్ చేయండి, మీరు ఏం తినకండి, your insulin flow will decrease. సో డయాబెటీస్లో ఆ బ్యాలెన్స్ ఖరాబ్ అవుతుంది. దట్స్ ద ఓన్లీ రీజన్ యూ హ్యావ్ టు చేంజ్ ద వే యూ లివ్, యూ హ్యావ్ టు చేంజ్ ద వే యూ ఈట్. అది మామూలుగా చిన్నగా మీరు చేంజెస్ చేయండి. అండ్ రిమెంబర్ ద అక్రోనిమ్ DIET. సో D is diet is most important thing. మీ కొద్దిగా స్టైల్, వాట్ ఎవర్ యూ హ్యావ్ బీన్ ఈటింగ్ ఫ్రమ్ ద టైమ్ యూ హ్యావ్ టేకెన్ బర్త్ కొద్దిగా మారిపోవాలి. అండ్ ఇఫ్ యూ కెన్ హ్యాండిల్ దట్ వెల్, take my words, diabetes is one of the best diseases you have it.
సో డయాబెటీస్ అనగానే అందరూ ఫస్ట్ డైటింగ్ స్టార్ట్ చేయాలి, వెయిట్ లాస్ అవ్వాలి, అండ్ దెన్ స్వీట్, షుగర్స్ అన్ని, కార్బ్స్ అవి ఇవి ఏమేమో కట్ చేసేయాలి, ఏదేదో డైట్ స్టార్ట్ చేసేయాలని తెగ హడావిడి పడిపోతారు. సో ఆ డైట్, మీరన్న డైట్ ఒకటేనా?
డెఫినెట్లీ ఆ డైట్ అండ్ నా డైట్ ఇస్ సేమే. ఫస్ట్ అండ్ ఫార్మోస్ట్ D అంటే డయట్. సో డయాబెటీస్ వాళ్ళకి కొద్దిగా ఫుడ్లో ఆర్ the way we eat కొద్దిగా చేంజెస్ కావాలి. మామూలుగా ఏంటి, we eat 2 times or 3 times in a day కదా. సో ఇట్స్ ఐదర్ మార్నింగ్, ఆఫ్టర్నూన్, ఈవినింగ్. నౌ డయాబెటిక్స్ వాళ్ళకి they cannot have the normal Andhra Telangana food the way we eat. It has to be small frequent meals. So breakfast time lo 3 dosas only in one time, adi bagledu. Rather you can afford to have 4 dosa also, but with a gap of 1 hour. Small frequent meals is what a diabetic diet is all about. So as I have told you, D is about the diet and you need to be careful about it. You maintain well and yes, you are conscious about your own food, kada? Like that, every person, once they're diagnosed with the diabetes, they need to be conscious about what they are eating, how much they are eating, and they need to have a eye on what do they eat. ఒక మాట మీకు చెప్పాలి and everybody else should know about it is, we tell our children, no pain, no gain. And that's what a diabetic patient should know. I want my diabetic patient, your audience, to live for 100 years if they have diabetes. And the only way they will live 100 years is by remembering one dictum in life: no pain, no gain. So if you want to have a gain, you want to live a blessed long life out of hospital, then definitely do follow the small tips which your doctor tells you, or many tips which are being, we'll be talking about it in this podcast. The IET is very simple. D is diet, I is insulin, E is exercise, and T is tablet. మీరు చూడండి, the biggest thing is diet and exercise. So people have to understand, as I've already told you, that no pain, no gain kada. E is exercise. If you want to live for 100 years, 100 minutes exercise chala avasaram. Everybody has to do it. Okay, ఒకసారి 1 hour or 100 minutes of walking. No. 20 minutes morning, 20 minutes afternoon, 20 minutes evening, and dinner tarvata 40 minutes walk. That is what is E all about. I is insulin, which everybody is scared of. Take my words, you don't need to be scared of insulin at all. Only doctor salah prakaranga తీసుకోండి and it's absolutely painless. Type 2 diabetics ki insulin, the need of insulin comes very later in life. That also your doctor can help you at maximum. But strictly saying no to insulin బాగలేదు, ఖచ్చితంగా you will have complications. And ఈ DIET లో మీరు T cancel చేయండి, then you die కదా. So that's what people should not do. నేను మా ప్రాక్టీస్లో ఏం చూసాను, that people go, any good doctor writes some medicines, దాని తర్వాత they go to chemist and then they'll say నాకు ఇదే మెడిసిన్ వద్దు, ఇదే వద్దు. So a chemist decides tablets for them, and playing around with tablet means you will die. And that is what I want everybody to understand. Do not play around with your tablets is my message to all the viewers out here.
సో ఇది వరకు పెళ్ళిళ్ళు అంటే ఎవరైనా ఆ ఎలియన్స్ తీసుకురావడం, ఆ మ్యాచ్ తీసుకురావడం, ఒకవేళ ఫలానా పెళ్లి సంబంధం వచ్చింది అంటే ఏమేమి ఫ్యాక్టర్స్ కన్సిడర్ చేసేవాళ్ళు? అబ్బాయి అందంగా ఉన్నాడా, అమ్మాయి అందంగా ఉందా, ఇద్దరు ఎంత బాగా చదువుకున్నారు, బ్యాక్గ్రౌండ్ ఏంటి, ఫ్యామిలీ బ్యాక్గ్రౌండ్ ఏంటి, ఫైనాన్షియల్ కంపాటబిలిటీ ఎంత. సో అవన్నీ చూసుకొని మ్యాచ్ చేసుకునేవాళ్ళు. ఈ మధ్య నేను కొత్తగా చూస్తున్నాను ఈ జనరేషన్లో ఏంటంటే మెడికల్ హిస్టరీ అడుగుతున్నారు. పెళ్లి సంబంధానికి ముందే మెడికల్ హిస్టరీ అడిగి, లేదా లెట్స్ నాట్ దే అరేంజ్డ్ మ్యారేజ్ అని కాకపోయినా, ఈవెన్ ఇఫ్ దే ఆర్ లైక్ ఇన్ అ రిలేషన్షిప్ ఆర్ లవ్ మ్యారేజ్, అలాంటి సిచ్యుయేషన్స్లో కూడా ఫస్ట్ మెడికల్ హిస్టరీ చూసుకుంటున్నారు. అందులో పెద్దవి ఉంటే ఓకే ఫైన్ కన్సిడర్ చేయొచ్చు, దానివల్ల అది సెట్ అవ్వలేదు అంటే ఓకే, దట్ విల్ మేక్ సెన్స్. I don't want to mention, but one of my friend, she broke her marriage. I mean, she broke her alliance just because that the guy, her fiancé, has been diagnosed with diabetes. So I don't know how sad it is, or do I have to console my friend, or do I have to explain that diabetes anta serious ga teeskokudani? Can you help us know like more sensible points about this?
పెళ్ళికి ముందు మెడికల్ హిస్టరీ చాలా ఇంపార్టెంట్. ఐఎమ్ వెరీ హ్యాపీ దట్ యూ హ్యావ్ టచ్డ్ అ వెరీ ఇంపార్టెంట్ టాపిక్. ఇప్పుడు వీ హ్యావ్ ఆల్సో స్టార్టెడ్ సంథింగ్ కాల్డ్ ఎస్ ప్రీ మ్యారిటల్ కౌన్సిలింగ్ యాజ్ వెల్ as టెస్టింగ్. See, when it is any marriage, whether it's arranged marriage, love marriage, marriage is a lifetime commitment chudali, at least at the beginning of it. So you should be checking out whatever the things which we can check. Lot of people give this excuse ki marriage tarvata, if you get to know it, when you have the time, doing a premarital counseling is chala important. I definitely believe it's a good point for the pelli koduko, whatever you call bride and the bridegroom, to get a premarital testing done. Ippudu we are in the forward generation. Before health insurance, before term plans, all the organization is asking for the blood test kada. So like that, it's a life planning. So health planning and term plans ki blood test kavali, ఖచ్చితంగా for the life planning ki kuda blood test kavali, and it's important that we should have that clarity. Marriage is something which is based on the trust, and whichever way we can have a kind of trust building done పెళ్ళికి ముందు ఖచ్చితంగా చేస్తే మంచిది. And even if it comes out during the testing that somebody is diabetic or somebody has got some infection or anything, ఖచ్చితంగా ఓపెన్గా డిస్కషన్ చేస్తేనే మంచిది. బట్ బికాస్ ఆఫ్ డయాబెటీస్ cancelling a marriage or thinking something else that is individual preference. Manamlo, a diabetic patient will live comfortably equal to anybody else. There is no doubt about it. Only thing is they need to be cautious about few specific things here and there. Ante enti that yes, they will be having some issues. So planning a child in the marriage is chala important. Yeah, sure.
So పెళ్ళి అవ్వక ముందే తెలిస్తే ఓకే, ఏదో దల్ కంటిన్యూ ఆర్ దల్ క్విట్, ఇట్స్ దేర్ పర్సనల్ కాల్. అదే పెళ్ళైన కొత్తలో లేదా పెళ్ళైన 1-2 yearsకి ఇట్స్ అబ్బాయినే కాదు, ఒకవేళ అమ్మాయికి డయాబెటీస్ ఉన్నా, ఇద్దరులో ఎవరికి డయాబెటీస్ ఉన్నా, దే జస్ట్ స్టార్ట్ హ్యావింగ్ లైక్ టూ మెనీ ఇష్యూస్. ఆ హ్యాపీ, ఆ లవ్లీ జోన్ ఆఫ్ మ్యారేజ్ కాస్త చిన్న చికాకులు, తర్వాత పెద్ద గొడవలు, అండ్ దెన్ కంప్లీట్ ఫ్యామిలీ డిస్టర్బ్ అయిపోయే స్టేజ్కి వెళ్ళిపోతుంది. ఎందుకని? అసలు ఆ డయాబెటీస్ వల్ల పెళ్ళిలో వచ్చే కాంప్లికేషన్స్ ఏంటి, అబ్బాయికి వచ్చే కాంప్లికేషన్స్ ఏంటి, అండ్ అమ్మాయి చూసే ప్రాబ్లమ్స్ ఏంటి?
పెళ్ళిలో డయాబెటీస్, how do you handle it? Diabetes can come anytime, any day to anybody. So diabetes gurinchi we have to discuss the marriage part of it, that is personal choice. But kachitanga you have to understand a few things. Diabetic patients ki, if we have to check it out, future low, every diabetic patient, especially males, they usually end up having some a disease called as erectile dysfunction or the sexual issues. The same thing happens to the women also. They get kind of frequent vaginal infections and all. So those things you have to keep in mind. But diabetes gurinchi discussion chesi or doubt chesi, you want to not considering marriage and all, I think that is a bit too far stretched precaution. But yeah, definitely there are people who take it, and I leave it for them to take that call. But from my side, I will say it is anybody can have any diseases. Marriage is something based on the mutual trust and understanding and going side by side with all the differences. So if meeku diabetes unnadi and the partner got to find it out, and then few adjustments untai, definitely you need to say the staying healthy attitude, adi daily life pattern kaadu, it is something in the brain. If you have got it that you want to live healthy and happy and smiling, you will know what to say no to. People who enjoy smoking, alcohol and 100 different kind of vices, but they also pay a price for it also. Like that, diabetes వాళ్ళకి కూడా they know it very well ki we have to avoid these things. Annam avoid చేయండి, అది క్లియర్ కట్ గా ఉంది. చికెన్, మటన్, whatever we like it, we all like it. Rayalaseema ruchulu food kada, we all love it a lot. But we need to understand, take one piece and leave, the hogging on the Hyderabadi biryani, we all like it, but we have to understand that we have to cut down on that. So, and again you take it from one different point. Instead of having husband and wife or the fiancé, both of them having one full serve of biryani differently, please make sure you take one and share half. That increases your love also. Life is all about how you take it and accept it and respond to it. And that's what I will call it about marriage as well as the diabetes. Live happy, smiling and a blessed married life with the diabetes. That's my message to all the audience out here.
పెళ్ళైంది 1-2 years బాగానే ఉన్నారు, ఎవ్రీథింగ్ ఇస్ ఫైన్, అండ్ దెన్ నౌ దే హ్యావ్ అ ఫ్యామిలీ ప్రెషర్ ఆఫ్ పిల్లలు ఎప్పుడు, that is from the in-laws on both the sides, and then only the couple knows that the husband is diabetic or wife is diabetic. ఇద్దరిలో ఎవరో ఒకరు diabetic in this condition. సో అలాంటప్పుడు the blame game starts. నీకు డయాబెటీస్ ఉన్నందువల్లే మనకి పిల్లలు అవ్వట్లేదు, అండ్ ఐ హ్యావ్ టు టేక్ సో మచ్ ఆఫ్ ప్రెషర్ ఫ్రమ్ యువర్ పేరెంట్స్ అండ్ మై పేరెంట్స్ అండ్ ఎవ్రీథింగ్, అండ్ దెన్ ఆ గొడవ ఎక్కడికో వెళ్ళిపోతుంది. డూ దే రియలీ హ్యావ్ టు బ్లేమ్ ఆన్ ఈచ్ అదర్?
Not at all.
And the diabetes in men, how is it going to affect them and the marriage?
Okay, you are coming to a complex discussion of diabetes and the sexual issues. Diabetes వాళ్ళకి they have lot of sexual issues if sugar control లేదు. If sugar control లేదు, ఖచ్చితంగా one of the commonest issue with men face is the erectile dysfunction or ED. ఇది మామూలుగా అది ఫైనాన్షియల్ ఈడీ లేదు విచ్ ఎవ్రీ బిజినెస్ మెన్ ఇస్ స్కేర్డ్ ఆఫ్. దిస్ ఇస్ ద erectile dysfunction which again majority of men get it, and primarily cause definitely is a psychogenic as well as uncontrolled sugars. Uncontrolled sugar వాళ్ళతో they have the decreased blood flow to the penis, plus there is some nervous issues, and because of all these things they also get a increased amount of penile infections. So ఒకసారి sugar control లేదు, you will have genital infections and intercourse becomes tough as well as painful, and that is where the diabetes troubles a marital life. So మీకు మంచి లైఫ్ కావాలి, మంచి marital life కావాలి, sugar has to be very well controlled. Your HbA1c, the మామూలుగా 3 months average sugar has to be between 6 to 7. So ఖచ్చితంగా 3 things I would want to talk about it. You must have a good sugar control, stay away from smoke, and have a healthy stature, obesity, and finally staying away from smoking. And all these habits lo Mona Chapali, every husband and wife have to come together as a couple. The blame game is the worst thing can happen in any marital life. You have married, you live with that person and accept it. There's nothing which more can be talked about it, and I'm very much sure all the big senior people who are watching this, they will know it. Marriage is a big commitment and it's not everybody's cup of tea. This is what we need to understand.
So true. So what if the wife is diabetic? How is it going to have an impact on her fertility rate or like?
Wife having a diabetes, I hope I'm not sounding too much of MCP or anything like this. Women per se, they have couple of more issues than men. The thyroid issues, 90% on the women than in the men. That's one part. Obviously the menstrual issues which we talk about, it is with women, and this thyroid, sugar, and the menstrual issues, they make women very moody. Okay, they have a lot of their hormonal fluctuations, and that is where the problem comes, because with high and low sugars, the normal way anybody behaves changes. The same thing happens with the man also. Now try to imagine a scenario where husband and wife both have a diabetes, so they will both have a fluctuation of sugars which will cause fluctuation of mood. Now that is kind of a messy thing. So that's where, say, some we call it ignorance is bliss, but not in this case. If somebody is behaving awkwardly, responding or becoming too angry, please check his or her sugars and thyroid levels. That is what is the most important point people should take home from here. If you have a diabetes, if you have a thyroid, it is going to affect your moods and the fluctuation and the body response, and that takes a proper professional consultation as well as adjustment of the dose as what your doctor suggests.
So are there any major misconceptions about diabetes screwing up the marriage?
I think not talking about it. See, we are in a society where we do not like to talk about these issues. See, I see the patients, and I know every diabetic patient has got a sexual issues, erectile dysfunction or the genitourinary infections, and nobody asks. Now imagine there is a man who's not having a proper erection, and that's because of diabetes. Will he come and tell it voluntarily to a doctor? Answer is no. No men want to accept it. But yes, the time doctor asks, he will immediately admit it, because he knows it is always there in his mind. So that is what we need to understand, ki there has to be a much better communication between the patient and the doctor, and patient should be open about it. And definitely again the privacy comes. A lot of doctors who see the patient along with the whole family, you need family to help out a patient, and as well as isolated conversation with the doctor is also needed. So that is where regular visits to a doctor is very much needed. One thing which I would want to tell it to you through your podcast to all my friends, you want to live for 100 years, you need to see your doctors 100 times in whole lifetime. ఇప్పుడు ఏమవుతుంది, if you have a diabetes, say I'll go to him once in 3 years, 4 years I'm taking the same medicine. అది తప్ప, అది చేయకూడదు. Every diabetic patient should go and see their doctor once in 100 days. Whether there is a complaint or not, whether there is a problem or not, you must go and say, Dr. Garu, na sugar test cheyandi, meeku em kavali cheppandi, any test required? Yes. Do you know what are the 3 big killers of Telugu land? One magic word and scary word is avasarama. Whenever we write some investigations, tak manu, the question pops up, sir, avasarama, naku em ledu kada. So this is that attitude where we do not want to test and we don't want to listen to a doctor, creates a big mess in anybody's life, and that fills our ICU. So if everybody with the diabetes has to know it, with the diabetes you can live happy, healthy and smiling if you are regular with your doctor in the OPD visits or even online consultation.
సో అవసరమా అని అనుకుంటే పేషెంట్ డయాబెటీస్ అనగానే డాక్టర్ దగ్గరికి వెళ్ళామా, మందులు రాశారు, ఇన్సులిన్ అన్నారు, డైట్ అన్నారు, ఎక్సర్సైజ్ అన్నారు, అన్నీ బాగానే ఉన్నాయి. ఒక 3 నెలలు వాడాం, 6 నెలలు వాడాం, తర్వాత ఒక 9 months ఎంత ఉంటే అంత, అంటే నార్మల్ లెవెల్స్కి వచ్చేంత వరకు. ఒక 1 month నుంచి షుగర్స్ పెరగట్లేదు, తగ్గట్లేదు. సో ఇందాక మీరు అన్నారు కదా డాక్ అవసరమా అని. సో ఆ స్టేజ్కి వచ్చేస్తారు. సో అప్పుడు ఏంటి, ఇంజెక్షన్ కూడా అవసరం లేదు, ఇన్సులిన్ షాట్స్ లేదా ట్యాబ్లెట్ అవసరం లేదు, ఎక్సర్సైజ్ ఏముంది, కొన్ని రోజులు రిలాక్స్ అవ్వచ్చు, చిల్ అవ్వచ్చు, డైట్ ఇష్టం ఉన్నది తినొచ్చు, షుగర్స్ కంట్రోల్లోనే ఉన్నాయి కదా అని అనుకునే వాళ్ళు ఉంటారా?
Yes, you are very much right. చాలా మంది పేషెంట్స్ దే సే సార్ ఇప్పుడు అన్ని నార్మల్ ఉంది కదా, and they stop on themselves, and that is the what we call the step, they start stepping towards their own suicide. I'm using a very very harsh language. They go to even patients, they have the full prescription of a good doctor, Apollo doctor or whatever, best doctor, and then they go to chemist and they'll say, sir, any medicines lo ide avasaram ledu, only sugar BP medicines END. And that is where the problem comes, because once they start managing their own medicines by themselves or with the help of their, my babai has told me, ippudu sugar control lone undi kada, you can stop insulin kada, and when they stop 3 months to 4 months, they will remain normal. Now, oka example istunanu, it's like you are going very smooth on a bike or a cycle with your hands off the steering. So imagine you're going, the bike without holding the handle of the cycle, and you're willing, everything is fine. That is what happens. You can go for 10 meters, 20 meters, 100 meters, and then suddenly you will have an accident. So tablet low changes or insulin or anything, nobody should do it by themselves. Only a professional help is needed. Okamata, I would want your audience to remember, go to a doctor when you do not need him. Manchiga vinandi. Go to a doctor when you do not need him, and you will never need him. The problem is people start taking the doctor for, just like this, and they become very casual. They'll say, naku em ledu kada, and then they don't go for a follow-up. And that is where the problems and the complications start creeping in. You should not go to the doctor when you get a symptoms. You should go to a doctor before symptoms occur. I hope that answers the question. So scared of these Telugu words, avasarama, and second Telugu word, which scares me is nenu anukunna. That's a number 1 killer of all my diabetic patients. Sir, nenu anukunna normal undi kada, ippudu bunch cheyochu kada, and that is where the patients, they die. If మీ ఛానల్ ద్వారా ఒక ఎగ్జాంపుల్ ఇవ్వాలి, యంగ్ 42 years old lady, కొన్ని రోజు బ్యాక్, she went for pilgrimage to Mecca. and అక్కడ she did not take the vaccination. So diabetics patients కి vaccination చాలా అవసరం, and she had uncontrolled sugars. అక్కడ వెళ్ళిన తర్వాత she got flu infection. She was admitted in ICU on ventilator. I got to know about the case because I helped her son in getting the passport. After he reached there, the only thing which we could do good was that he saw her alive. దాని తర్వాత కొన్ని రోజులు she died there. Young 42 years old lady dying of diabetes or a simple infection like influenza only because of two reasons. She did not control her sugars well, and she did not take flu vaccination. So diabetes kills. Only thing is, it completely preventable. Listen to your doctor before it is too late. And that's what I would want every single person who is watching this podcast to remember this. Go to a doctor when you do not need him, and you will never need him. Go to a doctor once in 100 days if you have diabetes, hypertension or thyroid or any lifestyle disease.
డాక్టర్ ఆశిష్, ఒకప్పుడు అంటే ఒక 40+ లేదా 50+ ఏజ్ వచ్చిన తర్వాత సడన్గా ఒంట్లో బాగాలేదు అనిపించినప్పుడు, లేదా కళ్ళు తిరుగుతున్నట్టు కానీ ఊరికే కళ్ళు తిరగడం, లేదా ఏదో నీరసంగా ఉండడం, అలాంటి సిచ్యువేషన్స్ దాటి వచ్చినప్పుడు డాక్టర్ దగ్గరికి వెళ్ళి సార్ ఒకసారి బీపీ చెక్ చేయించుకోండి, షుగర్స్ చెక్ చేయించుకోండి అంటే అప్పుడు చేయించుకునేవాళ్ళు. ఈ మధ్య ప్రతి చిన్నదానికి కంప్లీట్ హెల్త్ ప్రొఫైల్ అంటూ స్టార్ట్ చేశారు. ఏదేమైనా సరే, ఒక ఫీవర్ వచ్చినా సరే A to Z అన్ని ఇన్వెస్టిగేషన్స్ చేయించేసుకోవాలి, రైట్? సో అప్పుడు HbA1c అంటూ ఒకటి స్టార్ట్ చేశారు. హౌ ఇంపార్టెంట్ ఇట్ ఇస్, అండ్ ఎలాంటి ఏజ్ గ్రూప్ని అడ్రస్ చేస్తూ అది ఎంత ఇంపార్టెంటో చెప్పగలరా? అందరూ చేయించుకోవాలా, లేదా దానికి కూడా ఎలాగైనా క్రైటీరియా కన్సిడర్ చేయాలంటారా?
చిన్న చిన్న జబ్బుకి సిమ్టమ్స్కి డూయింగ్ అన్ని టెస్ట్స్ అవసరమా? దట్స్ అ బిట్ question where we need to have a lot of discussions. Number one, pre-COVID-లో కండిషన్ వేరుంటే ఇప్పుడు post-COVID it's a వేరే condition. Should we do the sugar test? Whenever you come to hospital, ఖచ్చితంగా చేయాలి, అందరికి చేయాలి. Even 5 years old, 6 years old or even 15 years old, అందరికి. మీకు సార్ నిన్నే ఒక పేషెంట్ గురించి I would want to tell. One patient came, sir, రిపోర్ట్ చూడండి అన్నీ నార్మల్. ఫాస్టింగ్ బ్లడ్ షుగర్ వాజ్ 86, విచ్ ఇస్ సూపర్ నార్మల్. బట్ అప్పుడు కూడా ఐ సెడ్ నో మీకు షుగర్ ఫీవర్ ఉంది కదా, ఐ వాంట్ టు చెక్ యువర్ షుగర్స్. అండ్ షీ వాజ్ అ నాన్ డయాబెటిక్ లేడీ, అండ్ వెన్ వీ చెక్డ్ హర్ షుగర్ ఇట్ వాజ్ 206. సో వాట్ యూ నీడ్ టు అండర్స్టాండ్ ఇట్ ఈస్, డయాబెటీస్ అందరికీ రావచ్చు. ఏదైనా నిన్న యువర్ షుగర్స్ ఆర్ నార్మల్, టుడే యూ కెన్ హ్యావ్ షుగర్స్ విచ్ ఆర్ హై. అండ్ to do the investigations and to do HbA1c is your call, but it's on the doctor's advice. One thing, Miku, I would want to tell you, Mona, is whenever doctor is suggesting any test, be careful not use the word avsarama nenu anukunna if you want to live longer. One thing negative about a Dr. Cheppali is they're very bad communicators. First 30 seconds they tell you the honest thing what you need to hear. 30 seconds tarvata they tell you what you want to listen. So first 30 seconds is the truth. After that they speak what you want to listen. So that time you say, sir naku ikkade manta undi, and then he will write ECG. Sir idi heart ledu kada, then he will say heart ledu poindi. So he is always advised you best treatment. Please listen to your doctor and definitely take the best treatment. Gone are those days when we used to use words like avsarama nenu anukunna and spoil your own health. Konni rojlu you have seen so many heart attacks kada. Everybody is going to gym and dying. On the cricket field they are dying, and somebody doing the fasting and dying. So it's not at all worth taking that risk. You have a symptoms, reach out for the professional help, do those investigations. And that investigations will 90% times it will be normal. Thank God. Don't blame your doctor. Ippudu 3 of us are here. Definitely one of us can be having diabetes without you and me knowing it also. Now are you thinking, can you have a diabetes? Answer is yes, you can. If you're not checked your sugars, you must check it. Especially if you're watching this podcast, you must check it once the interview is over. Everybody should check sugars, whenever there is a doubt, and especially if it is in the family history. మీ మదర్కి మీ ఫాదర్కి ఆర్ ఎనీబడి హ్యాస్ అ షుగర్, దెన్ ఫ్యామిలీ వాళ్ళకి అందరికీ చెక్ చేస్తే మంచిది. ఇఫ్ యూ హ్యావ్ స్ట్రెస్, యూ మస్ట్ చెక్ యూర్ షుగర్స్. ఇఫ్ యూఆర్ ఫ్యాట్ అండ్ obese, you must check your sugars. So these are the various things which everybody has to know. Do the test before it is too late. 3 T's to remember: test, trust, tablets. And that will make you live smilingly long, healthy life.
సో డాక్టర్ ఆశిష్, డయాబెటీస్ వల్ల డిప్రెషన్ వస్తుందా లేదా డిప్రెషన్ వల్ల డయాబెటీస్ వస్తుందా?
Very good question. Both are correct. If you have depression, you will have a diabetes. If you have diabetes, you will have depression, because ఒక స్టేజ్ వచ్చేస్తుంది సార్ నేను టాబ్లెట్ వాడుతున్నాను, ఐఎమ్ డూయింగ్ సో మచ్ ఆఫ్ ఎక్సర్సైజ్ అండ్ డైట్, అప్పుడు కూడా షుగర్ కంట్రోల్లో రావట్లేదు. సో దే బోత్ గో హ్యాండ్ ఇన్ హ్యాండ్. ఫస్ట్ డిఐఈటి చెప్పాను కదా మీకు, దట్ డయట్, ఇన్సులిన్, ఎక్సర్సైజ్, టాబ్లెట్స్. నెక్స్ట్ డిఐఈటి ఈస్ ద అన్టచ్డ్ questions or problems of a patient. D is depression, insomnia, erectile dysfunction, and tiredness. Chatkavattledu, the commonest word which all the diabetic patients talk about it.
అస్సలు ఓపిక లేదు ఇప్పుడు.
Absolutely. And that is where few animate around you who do not speak, but they give you more love than anybody else. Pets come into the scene. I'm really seeing that the way you're playing around with this little angel. He is a very good, and having pets like him around is a good one. What is he called, by the way?
His Coco.
So anybody who's got a pets like Coco around will have very healthy and happy and smiling life. So having pets is good, but make sure the way you have vaccinated Coco, right?
Yes, vaccinated.
So here is the thing is, the vaccinations which are needed for Coco is the same way you need vaccinations for a diabetic patient also.
Really?
Yes.
What sort of vaccinations?
There are many, and that is what we lose out when we are not giving time with a doctor. Every diabetic patient requires couple of vaccinations. I have already talked and gave the example of flu injection. 42 years old lady who died. So remember this acronym, the spelling of DIA. So D is for DTaP or the Boostrix, which is available. I is influenza or the pneumococcal vaccine. A and B is hepatitis A, hepatitis B. So like this you require lot of vaccines. I wouldn't want to talk about COVID vaccinations. We all know it's a bit controversial stuff. But other than these, everybody should take the vaccines whichever your doctor suggests. So if you have diabetes, please take flu shot, pneumococcal vaccine, Boostrix, and hepatitis A and B, and not to forget Shingrix or the shingles vaccine, which our big Bachchan Sahab is promoting like anything. Very much needed if you have diabetes.
Are there any strict no's and happy yes for a diabetic patient?
Many yes and many no's. Number first, yes, if I have to say the 3 T's. You must trust, you must test, and you must take your tablets. So 3 T's to remember. And then whenever we talk about T, we always talk about S. So here is the strict no for the diabetics. No to stress. Ottadi undukodu. Chinta chita saman hoti hai. So that means stress will get you to a graveyard. No stress, no sedentary lifestyle. Kachitanga regular walk is chala important. Exercise chala important. You have to have a regular exercise. Exercise enti SAFE, safe exercise. Strengthening, aerobics, flexibility, endurance. So SAFE, strengthening, aerobic, flexibility, and endurance exercise. So no smoking, no spirits, no stress, no sugar, salt, and spices. So మీ ఫుడ్ after one age దాటిన తర్వాత your food should be రూఖా సూఖా ఫీకా, tasteless ఉంటేనే మంచిది. Say మొన్ననే few years back I was in China, and you definitely know, where do the people live longest? The people from China and Japan. They live 80, 90, 100. And check their food. వాళ్ళది ఫుడ్ మన చైనీస్ ఫుడ్ ఇక్కడే వి గెట్ ఇట్ కదా, మంచూరియన్. దే డోంట్ హ్యావ్ దిస్ టర్మినాలజీ ఆల్సో. మంచూరియన్ ఏముండదు. వాళ్ళది ఫుడ్ ఈజ్ అబ్సల్యూట్ టేస్ట్లెస్. It's a bland food. So what we eat here, saying the Chinese food, actually it's a Indian food only, which we are making as per our taste buds.
I think
So long life kosam rukha sukha pika, no salt, no sugar and no spices. Could the alvat cheskondi ade అయిపోతుంది. అట్లా ఎంత టఫ్ లేదు.
ఐ థింక్ ఇండియన్ ఫుడ్ ఒక్క దాంట్లోనే అనుకుంటా ఇన్ని ఫ్లేవర్స్, ఇన్ని స్పైసెస్, సాల్ట్ ఖచ్చితం, స్వీట్ ఖచ్చితం, షుగర్ ఖచ్చితం.
So I definitely know somebody known to me very well, and the time she got to know that she has a diabetes, completely she takes sugarless tea and coffee. ఒకసారి అలవాటు అయిపోతుంది. So you must get used to it. ఎప్పుడు కూడా majority of endocrinologists, they do not take sweet sugar and sugary drinks. So we all have to understand there is a lot of consumerism around. Either sugar drinks, whatever the branded drinks which we have, they're not good for the health. Andariki telusu. So go, what is the best drink to have it? Mineral, simple water. Have a regular water, hydrate yourself well. Sleeplessness undakodu. You need to have 8 hours of sleep very well.
Proper
6 to
sound
8, 6 to 9. Absolute dark room undali. That only will get the melatonin to be secreted in a good profuse amount. So sleeplessness is a pedda problem. Ipudu IT population kada. So they all have their cell phones. This is the biggest blessing and the biggest curse to mankind.
So
is the
true.
cell phone. So if you have a diabetes, if you do not have a life like that of a doctor or police or emergency services, cell phone 8 p.m. till 8 a.m. band undali. And that is what everybody needs to understand. So sleeplessness bagledu. Sleeplessness unte, you will be obese. So if you're sleeping less, you will be fat. And finally, the 9th S is, there's something called as sexual deprivation. And that is what people need to address about it. There is something called as the physical needs, and that you should not deprive yourself with. So these are the S. Stress, smoking, spirits, alcohol, bagledu. Sedentary lifestyle, bagledu. Sugar, salt, spices, bagledu. Sleeplessness, bagledu. If every person who is watching this podcast forwards this to his or her friend who's got diabetes, India will have a 0 death because of diabetes if only they listen to the doctor and they continue watching Med Talk with Moana.
థ్యాంక్ యూ సో మచ్ డాక్టర్ ఆశిష్. సో ఎవరో ఒకరికి ఒక డౌట్ వచ్చింది, డయాబెటీస్ అంటే షుగర్ తినకపోతే చాలు, స్వీట్స్ తినకపోతే చాలు కదా, డాక్టర్ ఏంటి సాల్ట్ కూడా తినొద్దు అంటున్నారు, స్పైసెస్ కూడా ఉండొద్దు అంటున్నారు అని. వై?
There's a very old lovely saying in we all know it. Somebody asked Buddha, what is poison? An answer, what did he give is very simple ga. Anything in excess is poison. ఇప్పుడు మాకు అలవాటే ఉన్నది which is not good. We are tuned that in food there should be a lot of salt, sugar and spices. So we have to become normal. ఇప్పుడు we have been eating abnormal. We have been eating, say, ఇప్పుడు we are seeing everybody's got AC, Uber, taxis and all. 50 years back, అది లేదు కదా. So that's why when we were eating lot and lot of rice, we were consuming it. ఇప్పుడు we are not consuming what we eat. So that is what it is. Dara Singh is a well-known wrestler and whatever the actor. He used to have so many kgs of ghee. You and me can't have it. It will be dangerous for our body. And post-COVID, definitely you need to watch out for your health, especially for your heart. So listen to your heart. Follow this ABCD if you have a diabetes. A is A1C, sugar test cheyali once in 3 months. B is BP and blood sugar. 100 times testing to live for 100 years. Ante varaniki 2 sarlu. C is creatinine, C is cholesterol. That should be controlled. Creatinine should be checked, it should be 1. D is diet. Andariki telusu. What to eat in diabetes? Very easy. Uncooked food. Problem is a kitchen. Meeku edaina fruits kavali tinachu, but you have to make sure fruits are good. Fruit juice bagledu. Doskai kheera, mulangikaya, pach onions, pach tomato, excellent, you must have it. Cooking makes things bad. So ABCD. E ante exercise or elective procedures. Meeku dental checkup once in 6 months. So naku em ledu kada, why should I go to doctor? Adi tappu. You should go to a doctor when you do not need him, and you will never need him. So ABCD. E ayindi. F ante fundus examination, eye testing. Because retinopathy comes much before the big problems come. So you must go to a dentist once in 6 months. You must go to your ophthalmologist once in 6 months. You must go to a diabetologist or the physician regularly in 100 days to live for 100 years. I hope the people who watch Med Talk with Mona will live healthy, happy, and smiling longer.
Thank you so much, doctor. It's so happy to hear.
And definitely keep smiling, because smile, the curve line straightens up everything in your life. Take care. God bless. Goodbye. You have any doubt, feel free to reach out to me or write your comments on the section. Otherwise, I'm available at 810-612-7475. And anybody who puts comments in this podcast will get a free consultation from me.
Oh wow, so happy to know that. So dear viewers, అందరూ కరెక్ట్గా వినేసారా? హూసోఎవర్ ఎపిసోడ్ మొత్తం చూసి మీకు ఎలాంటి డౌట్స్ ఉన్నా లేకపోతే ఇంకేమన్నా తెలుసుకోవాలనుకుంటున్నా kindly mention in the comments. So whosoever is like mentioning in the comments will get a free consultation with Dr. Ashish at Apollo Hospitals.
Definitely. Not only Apollo Hospitals, Ankura Hospitals, Nanakramgoda, Ethan's Clinic, Garden Towers, Masap Tank, or Live Life Clinic, Gachibowli. This is for you because only I have one desire. Can I keep all my diabetic patients out of hospital for 100 years? I can't do it alone unless you want to do it. I hope you got the message. Take care. God bless. Goodbye. Namaskar.